Ford pledges increased testing in long-term care homes as deaths climb in facilities by the Canadian Press. Ontario will increase COVID-19 testing in its long-term care homes in an effort to pinpoint how the virus is getting into the facilities, Premier Doug Ford said Monday, as more new cases and deaths were reported in this sector. Better surveillance testing for residents, staff, and visitors, which is conducted even if a person does not have symptoms of the virus, and faster turnaround times for results are needed to get at the root cause of this rising infection rates, Ford said. Quote, "We need to lock it down," he told reporters, "not just testing people, but getting the results back and having a standard test that we can get it back in 24 hours, 48 hours. Ford's comments came after the province reported 20 deaths among its nursing home residents on Sunday. Another 4 resident deaths were reported on Monday. According to the province, 107 of Ontario's 626 long-term care homes are currently experiencing an outbreak, and 716 residents currently having COVID-19. Data released by the government last week showed that the mortality rates in long-term care homes have been on the rise during the second wave of the pandemic. Overall, 2,145 residents of Ontario's long-term care homes have died since the start of this pandemic. Ford suggested staff and visitors may unwittingly be bringing the virus into long care homes. Rapid COVID-19 tests may help when they arrive in Ontario, he added. Quote, "Go to the root cause. Why do we have an infection?" he said. "It's not coming in from the clouds. It's not coming in from the patients. It's coming in from the outside." Nathan Stahl, a clinical epidemiology and healthcare researcher at the University of Toronto, said bolster testing will not be enough to halt the spread of COVID-19 in a long-term care. Quote, "Testing is an important tool to try to help prevent and mitigate outbreak," he said, "but it is a downstream solution. If the Premier wants to talk about the root cause is about suppressing transmission of COVID-19 in the community." Stahl said the government must impose strict measures to eliminate community spread to a point where public health officials can once again effectively conduct contact tracing. Quote, "With the levels of cases we have now, it will require a substantial shutdown instead of trying to manage what I would call now a controlled burn, which is spiraling out of control." Ontario reported 1,487 new cases of COVID on Monday and 10 new deaths due to the virus. The government said that 508 of the cases were in Toronto and 392 in Peel region, with 170 in the York region. Toronto, the long-term care minister, Marilee Fullerton, said Monday that the province is revamping criteria that would reduce access to homes in COVID-19 hotspots. Well, yeah. Public health units can also impose their own measures if they deem necessary, she added, without specifying what those might be. Quote, "We learned this is in the first wave, that actually the public health units can actually respond fast," she said. "The province's measures take somewhat longer. And if you think time is of essence, I say we need to respond in COVID time, and medical officers of health can do that." The NDP leader, Andrea Horwath, accused Fullerton of ducking her responsibility as a minister. Quote, "It looks like she's preparing to scapegoat public health departments as a result of the government's failures," Horwath said. "The government did nothing all summer long. They didn't hire more PSWs. They didn't bring in infection control specialists for each and every home." The Liberal House leader, John Fraser, said that Fullerton was minimizing her role in the state of long-term care homes. Quote, "The minister should just take responsibility and own it." Fullerton's office later clarified her remarks, saying local health units can layer on additional visitor restrictions to the government's current COVID-19 response system. Quote, "We will continue to work together with all partners to protect our most vulnerable," spokesman Christy Caputo said. Oh, Caputo cheese. Meanwhile, the province introduced a new strategy Monday to prevent and control COVID-19 outbreaks on farms. It said the plan will bolster inspections, infection control measures, and virus testing. The province said it had a federal The federal government are committed to $26 million in support on farm health and safety. It will contribute an additional $25 million over 3 years to minimize the risk of agri-food workplace exposure. The move 3 years. The move comes after hundreds of migrant workers in southwestern Ontario contracted COVID-19, shining a light on their work and living conditions during the pandemic. This report is first published by the Canadian Press, November 16, 2020. Canadian Press. It's going to get colder. It's colder weather. It's when the flu comes. So I imagine this is similar. I don't know. I'm not a doctor, but pretty simple. We're hitting the darker times. It's just, and these old age homes needs to be something done about it. In my personal opinion, I don't have the answer. I'm just saying something needs to be done, and I care not what, just something. Anyway, leave your comments below too, and like, subscribe, share, and there's a few more comments. So stay tuned, stay frosty. Have a good night.